the cardio that you're doing, the peripheral vascular in conjunction. You should have both on the sheet that I gave you, the checkoff list. So we'll go ahead and get started. I first wash my hands. Hi, my name is Christina. I'm the PA student. I'll be doing your exam today, the cardiovascular, peripheral vascular system. First, I'm assessing the chart. The nurse has taken the blood pressure. Normal is 120/80. The heart, I'm looking at the heart rate. Normal is 60 to 100, and I'm estimating the JVP, the jugular venous pressure. I'm going to ask the patient to lie back. Make sure that the head of the bed is elevated 30 degrees, and ask that they look to their left, please. I'm identifying the oscillation of the oscillation of the internal jugular vein, where at the highest point where it moves. And I'm going to place my 3x5 card at that spot horizontally. And then I'm going to take my ruler and place it at the sternal angle and measure the height, make a 90-degree angle with the card, which is at 1.5 centimeter. The normal JVP is less than 3 to 4 centimeters. And that tells you the right atrial pressure. Then I'm inspecting the chest. I'm looking for any lesions, any rashes, any deformities, any scars. Then I'm palpating in all 6 areas. I'm using the fingers first in the aortic, pulmonic, tricuspid, and mitral areas. I'm feeling for any lifts against my hand, any thrills, or any heaves. Then I'm feeling with the ball of my hand, aortic, pulmonic, tricuspid, and mitral. Again, feeling for any lifts, heaves, or thrills. Then I'm going to locate the PMI, which is the point of maximal impulse, where you feel the pulse the strongest. It's also called the apical impulse, and it's in the mitral area. You should feel it at the left fifth interspace, at the midclavicular line. You can use your fingers or the ball of your hand to assess it. It should be 2.5 centimeters in diameter or less at that spot. Then I'm going to assess the right ventricular impulse. I'm going to line up at the 3rd, 4th, and 5th intercostal spaces. And then also in the epigastrum, noting for the right ventricular impulse. Then I'm going to auscultate. When I'm listening, I'm identifying S1, S2, listening for any S3, S4, any murmurs. I'm listening to the rate and rhythm of the heartbeat. I'm starting with my diaphragm in all 6 areas. I'll start in the aortic, which is the right 2nd interspace. Pulmonic, which is the left 2nd interspace and the left 3rd interspace. Tricuspid, which is at the sternal border, the left 4th interspace and the left 5th interspace. And then the mitral or apical area, which is the left 5th interspace midclavicular. Again, observing the rate, or listening for the rate and rhythm. Then I'm going through all 6 areas again with the bell of my stethoscope, starting in the aortic, pulmonic, the 2nd and 3rd, the tricuspid, which is the 4th and the 5th, and then the mitral area. Then I'm going to screen for mitral stenosis. I'm going to ask the patient to turn over in the left lateral decubitus position, please. With the bell of my stethoscope, I'm listening at the left 5th intercostal space, midclavicular line. And I'm listening for an opening snap and a low-pitched diastolic rumble, indicative of mitral stenosis. Then I'll ask the patient to sit up. Again, I'm inspecting the chest. I'm noting the venous pattern, any deformities, lesions, rashes, scars. Then I'm going to palpate the carotid pulses. Remember, I'm doing that one at a time. Feeling for a brisk upstroke. And then I would listen with the diaphragm of my stethoscope for any bruits in the carotid artery. I would ask the patient to please hold their breath. And assess both sides. Then I would listen to all 6 areas again with the patient now sitting, starting with the diaphragm, aortic, right 2nd interspace, pulmonic, left 2nd interspace, and left third interspace. Tricuspid, left fourth and fifth at the sternal border. And then the mitral or apical area, the left fifth at the left midclavicular. Same thing with the bell, aortic, pulmonic, tricuspid, and mitral. Noting the rate, rhythm, S1, S2, S3, listening for any murmurs. Then I'm going to screen for aortic regurgitation. I'm going to ask the patient to lean forward a little bit, please. And I'm starting at the left second interspace. Ask the patient to breathe in and exhale fully and hold out. And slowly inch my way down to the apex of the heart, and I'm listening for a high-pitched diastolic murmur, accentuated when leaning forward. Then I'm going to do the peripheral vascular exam. I'm inspecting the upper extremities. I'm looking for any edema, any lesions, scars, rashes, any deformities. I'm looking at the color. I'm looking at the nails. They should be pink. I'm checking the capillary refill, 2 to 3 seconds, and no clubbing or cyanosis. Then I'm feeling the texture and the temperature of the upper extremities. Then I'm going to assess the pulses. I'm checking the radial pulse, and I would do that bilaterally. And the ulnar pulse, bilaterally. And the brachial. Pulses should be normal, brisk, 2+. Now I'm checking the epitrochlear and lymph nodes. You can feel right there. I'm feeling for the size, shape, and consistency, mobility. And then I'm going to perform the Allen test. I'm going to ask the patient to open their hand. And I'm compressing the radial and ulnar artery and make a fist, and open, and fist, open, hold open. The hand is pale. I'm checking the patency of the radial artery. I'm going to lift up on that finger, and the hand should turn pink within a few seconds. Now I'm going to do it again one more time. Keep the hand open, and assess the patency of the ulnar artery. This is called the Allen test. As the hand turns pink, I would do this bilaterally. Then I would assess the lower extremities. I would ask the patient to please lie down. I'm assessing the color, the hair distribution. I'm looking for any edema, any varicosities, any scars, lesions. I'm looking at the toes, any clubbing, cyanosis, cap refill should be 2 to 3 seconds. I'm assessing the texture and the temperature of the skin. Sorry, guys. Now I'm inspecting the pulses. Sorry. Do you mind if I reach under the skin? I'm feeling for the femoral pulse. And I would check that bilaterally. The popliteal, which is behind the knee. And this one. The dorsalis pedis, which is just lateral to the great toe extensor. And the posterior tibial pulse, which is behind the medial malleolus. I'm feeling the rate and rhythm should be a brisk 2+. And I'm palpating for the inguinal lymph nodes. I'm feeling for the horizontal group and the vertical chain as well, noting the size, shape, and mobility. Then I'm checking for arterial insufficiency. I'm going to raise the legs of the patient about 60 degrees for about 30 to 60 seconds and watch as they turn pale. What is this position called? Trendelenburg, good. And then have them sit up. And notice the color returns to the lower extremity, should take about 10 to 15 seconds. I'm also noting for any pitting edema. I would check on the back of the foot and on the shins, just depressing with my thumb and looking for an induration. If there was any edema, it would be graded on a scale from 0 to 4. I would also assess the ABI, the ankle brachial index, by using a Doppler and checking the brachial and the dorsalis pedis and the posterior tibial pulses with the Doppler for that. Then I would ask the patient to please stand up and I'm assessing the calves, feeling for any tenderness, varicosities, any edema, and screening for any DVTs, deep vein thrombosis. That's it.
Well done, Mike.